Okay, so I've just clicked record and we're on. So I might just quickly give you guys a brief introduction on who I am. Some of you might not have attended a webinar before. Some of you might recognize me from last week, but my name's Mary and I'm the new health educator here at Arthritis, New South Wales. So I'll be one of the people you can connect with here at the organisation. If you have any questions around your condition or you have any questions coming you want to direct to the hotline, I will be the one behind the computer responding to those. I'll also be responding to the e-news articles and the questions and putting you in contact with some of the services we have here available at the organisation. A little bit of background, I have a strong nutrition background. I was a clinical nutritionist and a lecturer before I came on board here. So any nutrition related questions, more than happy to sit back and have a chat with you about those. So what we'll do in terms of housekeeping is once I finish the recording, like I said a little bit earlier, if you want to stick around and have a bit of a chat, I'm more than happy to. At the very end of the presentation, I'll open the floor to any questions you might have. If you haven't used Zoom before, I'll let you know of a few functions you can be aware of. The chat box for one is where you can ask all your questions, respond to questions. It appears to be a little speech bubble that you can click and type into. I've just had one person comment that you can't hear anything. Do you want to check if your sound is switched on? Is anyone else having a little bit of difficulty hearing me? Tony, you can hear me okay?
Yes, Mary, I can hear you clearly.
Great. Narelle, maybe you can have a look at the settings below and see if you can switch up that sound and see if that makes any difference. You'll notice at the bottom we have switched on subtitles, and so if they do happen to get a little bit distracting in the function area on the Zoom, you might be able to click CC and that will switch off the subtitles. That's only if you find them to be quite distracting. Otherwise, feel free to leave them on. And if you could all switch your microphones off while we get started, that will be wonderful. Okay. So today's session is about carer support. So providing care for someone with arthritis. I've had another person who stepped in and mentions he can't hear anything. What I'll do is I'll pause the recording. Okay, so we'll just continue on and hopefully we can troubleshoot some of those challenges while I continue. We do have a disclaimer here. It's just to let you know that the information that we cover here today is just to build your understanding and provide some general advice around managing arthritis. We do make sure the information we share with you is evidence-based, it's accurate, reliable, in saying that it really shouldn't be a substitute for individual treatment advice. So should you have specific questions about your condition, you should always speak with your doctor or primary healthcare provider in that instance. Okay, so what tonight's webinar is about is really helping you understand arthritis. And so if you are a carer of someone living with arthritis, or even if you're here to learn a little bit more about your condition, caring for yourself, we'll take a deeper dive into that and what caring looks like. So there is a lot to know about caring for someone with arthritis, and hopefully we're able to unpack some of the key things you need to know about providing that care. So it can be challenging
And so we will briefly touch on those associated challenges and the greater impacts it can have, so we can then delve into talking about some solutions and some practical tips. There are a lot of different resources and services available to support you when you have either received a diagnosis of arthritis, or if you're caring for someone with arthritis. There is a lot of support you have available and schemes available to make that caring journey a little easier. So what I'll do is I'll bring them to your attention, just in the case you haven't been made aware of them. So at the very end of the presentation, I'll show you, we'll direct you to some services and support networks for reference, and share some links and hotlines with you, just in the case they could be very helpful for you. So what I've got here is just a little bit of an overview of the data that was pulled out of the National 2022 Carer Survey. So what I want to highlight here is that what we know is that across New South Wales, we have approximately 854,300 carers. This is the equivalent to almost 1 in 8 people. 1 in 3 primary carers care for their partner, 1 in 4 care for their child. And on average, following a diagnosis, 14.6 years is the average length of the caring role. So I highlight this information to you to let you know that you're not alone. If you are caring for a spouse, a family member, a child, or a close friend, often it is because we love the person that we're caring about. It can bring us feelings of fulfillment, compassion, companionship, satisfaction. It could be just that you are improving someone you love's quality of life. And so there could be many other reasons as well, like personal growth, development of new skills, new challenges, or it could even be in the case where no one else is available to provide that care. So often we care for a combination of personal, emotional, and practical factors. So the role of a carer is specifically to provide care and support to a family member or a friend or loved one with a chronic condition, such as arthritis. And so what I want to share with you is that there are over 100 different types of arthritic conditions which affect the musculoskeletal system. More specifically, they do affect the joints, and how these symptoms manifest in someone, it does depend on the type of arthritis they have been diagnosed with. The most prevalent forms of arthritis that we see are osteoarthritis, which is a non-inflammatory form of arthritis that consequently follows the wear and tear of the cartilage in load-bearing joints. The other most common type of arthritis we see is rheumatoid arthritis, which is more of a pro-inflammatory form of arthritis that is associated with an autoimmune disease. And so what I want to find out a little bit more about is what brings you here tonight. If you are here as a carer, I'd love to hear from you in the chat box in terms of who are you providing care for and what type of arthritis do they have. If you're not here as a carer, I would also love to hear from you and hear about what you hope to learn about today. It might not be that you are a caregiver, but you're here to learn some things about caring for yourself even. Narelle, I'll try, I'll just pause the recording. So Tony, your mum has arthritis, osteo, and you would like to understand a bit more about how to support her. It's great. Okay. So I guess if you're providing care to someone, the role of a caregiver is multifaceted. When you're caring for someone living with arthritis, the key skills required are really built on understanding, supporting, and communication. What I want to highlight is that in your caring journey, there will be some things that are within your control and some things outside of your control. In most types of arthritis, pain, the discomfort, the distress, anxiety, depression, and frustration are very common experiences. When you see the person that you love and care for in pain, it can be really challenging that you're not able to help them completely alleviate the pain. And so it can take some time to accept that being pain-free is not going to be possible, as some of these arthritic diseases are degenerative. But with time and more understanding around the condition, it can help you find better ways to support that person living with arthritis. If you're here for yourself, understanding your condition is really key to self-managing the symptoms and particularly the pain. So the key to understanding arthritis often involves educating yourself, learning more about the pharmacological and non-pharmacological treatment options. These include exercise, there are mind-body techniques, stress management techniques, and there's also different government-funded services which may be available for you to help address the needs of someone living with arthritis. So these things are within your control and not only beneficial in that it can help with the longer term management, but as a carer, it can help you provide better support. So if you're here for yourself, or if you have a key role in advocating for the person you care for, which involves you being their voice and ensuring they receive the necessary care, support, and resources to manage their arthritis, communication is really going to be essential to understanding their specific condition and how to go about best supporting that person living with arthritis. So this brings me to communicating effectively. So in order to build your capacity as a carer and advocate for the person you care for, effective communication with medical staff and healthcare providers is going to be really important when you want to make sure that your loved one has the right people involved in their care and the right treatment options available for their specific needs. And so if you're attending the appointments or you're picking up the prescriptions, don't be afraid to ask a lot of questions, whether it's about what treatment options are available, what are the possible side effects, what do I need to look out for. You are encouraged to ask the healthcare professionals that are involved in their treatment about their roles, inquire about the different treatment options available, what's being recommended, and their efficacy. If you need to, don't be afraid to take lots of notes or even request a leaflet or a website to refer to later on. As a carer, don't be afraid to ask for help. So if you're looking after someone who has a more severe form of arthritis, there's going to be good days, but there are going to be very bad days. If you start to notice anything out of the ordinary, or if you have concerns that arise, you can always discuss them with someone from the healthcare team, or you can even seek a second opinion, but make sure that you don't hesitate to ask for help. I want to go to this question. Do you know what arthritis looks like? So there are many different types of arthritis that exist, all which are very painful. So the hallmark symptoms of arthritis usually include pain, stiffness, and swelling around the joints. Now, often in osteoarthritis, the pain will be more localized in a specific joint that has deteriorated over time with that wear and tear. In rheumatoid arthritis, because it is an autoimmune disease and because it is inflammatory, the pain can affect different sites in the body. And this is just because of how the immune system ramps up the inflammation and attacks the cartilage in the joint. Over time, this can cause damage and it can exacerbate the pain cycle. The main joints that we see affected in arthritis are usually the knee, the hip, and the spine. But not only does it lead to these painful symptoms, it can also exacerbate other symptoms like fatigue. It can affect mood, energy levels, behaviors, ability, and willingness to participate in social activities. And so to understand how these specific symptoms are affecting your loved one, you can ask a lot of questions about how their arthritis is affecting them today, what type of medication do they need, what tasks and exercises can and can't they do, and if they're experiencing a flare-up, they might have found a preferred pain management technique or a strategy that just works for them. So it can really help to have a conversation about what their preferred pain management strategies are. The chronicity of pain and the symptoms can really vary on a day-to-day basis. It can come and go. And as a result, I can imagine that your caregiving duties would probably look different on a day-to-day basis as well. So what I want to talk about are just some of the key things that are going to be involved in providing care to the person living with arthritis. So physical activity. Regular exercise can really help manage arthritis symptoms, improve overall health. And usually the joint-friendly exercises are going to be prescribed by certified exercise specialists to help increase strength, lubricate the joints, and nourish the cartilage, which are going to be beneficial for the longer-term management of arthritis. It can be a bit scary to engage in physical activity, especially on a bad day. So what you can do as a carer is encourage your loved one to do low impact exercises, stretches, find out what they can and can't do on a bad day. And even for your own long-term health, you could even join them to ensure that you're getting your physical activity in. With nutrition, you might have a more hands-on role in doing the groceries, cooking, feeding your loved ones, your family, and correcting the nutrition can not only be beneficial for controlling that inflammatory responses during a flare, it can help with other things like longer-term weight management, which will help with that longer-term protection of the joints and hopefully prevent that further degeneration. So the weight management component here in treatment can be very beneficial in that it can help alleviate some of that pressure on the joints, and we'll speak more to that very shortly. Assistive devices. If you haven't looked into these, or if you're not familiar with these, walking aids, grip aids, special kitchen utensils, there are assistive aids available which can help make daily activities a lot easier for your loved ones. So the need of assistive devices usually depends on the progression of the disease and where the arthritis is located. But in order to access these, you might actually want to consult with a physical therapist or an occupational therapist to identify the right assistive devices for your loved one, or if you're here for yourself. There are some organizations you can actually look at their websites and you can see what assistive aids are available. Medications are the most common form of treatment for pain. So there are a lot of different medications that are used for pain management, a lot available over the counter, but also prescribed. They do all have different mechanisms, and we'll touch on that shortly. But what I want to really highlight here is that they don't treat the condition, which is why we also talk about building your understanding around non-pharmacological treatments for the longer term self-management and awareness, that they can actually help with not just pain management, but improving quality of life and well-being. The final domain here is planning for the future. So if receiving a diagnosis of arthritis can bring about a lot of uncertainty in terms of the future for both the person living with arthritis and the family, the spouse and the friends. And so you do want to talk to your loved one openly about the future. Consider discussing long-term care needs, financial planning, legal arrangements, even home modifications. Later on in the seminar, I've got a section where I will talk a little bit about the different government-funded schemes that are available and how they might be appropriate for you and your loved ones. So the provision of care can really change over the years, and particularly more in the advanced stages of the condition. So what we want to make sure you take away from today is some strategies that can really help equip you for that longer term management. So exercise, I'm sure you have all heard of it before, but there are extensive amount of benefits to exercising and staying active for arthritis. There are going to be some days that are easier to complete some exercises, but therapeutic exercises are often prescribed by a physio or an exercise physiologist, which are tailored specifically to the person living with arthritis needs and limitations. Exercise really needs to be encouraged and supported because of how it can help strengthen the muscle around the joints, which can help with things like improving joint stability, increasing strength, protecting the joint through movement, all which can help in pain management, reducing stiffness over time. And this is why exercise falls into those main treatment categories. There are often a variety of joint-friendly exercises that are low impact and gentle, such as walking, swimming, sometimes cycling, which are encouraged to help build strength, increase flexibility, increase movement. And some days it can be more challenging than others to stay motivated. To keep the person you care about motivated, your encouragement, emotional support can really go a long way. You might be able to help them warm up for some of their exercises. You could help them track their progress by logging their exercise routine, make sure they have comfortable attire for exercises, but even in terms of your own long-term health, staying active is crucial. And so it is really important that it's maintaining, staying physically active and exercising regularly is, a part of the treatment strategies in your household. If you do have any injuries or limitations and you're not sure what exercise is going to be appropriate for your loved one, or even yourself, certainly speak with a doctor or a health professional. They will have lots of information and programs available on the that resources that you can access to read more into exercises specifically for arthritis. So we also have a lot of information and programs available on our website that can really help. If you're not aware, we have a Get Moving and a Get Moving Plus program. This is coordinated by our team, and there's a lot of information you can access on the website if you wish to look more into those. In terms of the best diet for managing arthritis, it is a common question that comes through, and the best response I usually give is a simple, healthy one. Some types of arthritis are inflammatory, and sometimes the pain cycle that is associated with arthritis is exacerbated or worsened by inflammation. So inflammation can be influenced by a lot of different things in the body, but it can be worsened by things like excess weight, processed foods in the diet, high intakes of sugar, saturated fats, alcohol. And so adopting an anti-inflammatory style diet in the household can be really beneficial for targeting a lot of those different components that are involved in driving inflammation. Improving weight management, supporting long-term bone health, reducing inflammation. Research has even shown that 5% of total body weight loss can improve joint function by 30%. So adopting a healthy diet with a lot of fresh fruits, vegetables, whole grains, nuts, seafood, legumes, beans, these can really be beneficial for implementing that anti-inflammatory style diet and also long-term weight management. So I'm not sure if all of you have heard of the Mediterranean diet. It's another form of an anti-inflammatory diet, but very effective for bringing in a lot of different nutrients, antioxidants, vitamins, minerals that are effective for targeting inflammation in the body. So foods which are common culprits for triggering inflammation, I really encourage you guys to avoid them. You might want to look into investigating if these are your specific trigger foods, or if you notice the person you care for eating a lot of these trigger foods, you might want to look at least reducing or removing them from the diet. As a carer, it can be really hard sometimes with such little time on your plate as it is. It can be really easy to rely on quick, convenient foods. If you feel your diet is something that you really need to work on more, or you want to work on more, usually a good starting point is planning meals and snacks ahead of time. Having a plan in place for the week ahead can really go a long way, especially when you are caring for someone else with very specific needs. For more specific dietary advice, it can be really beneficial with consulting with registered dietitians or nutritionists who can help you and your loved one eat healthier. And so what they usually do is factor in your specific needs, your preferences, and they can help you put together a well-rounded diet that's going to work for you, and it's going to be conducive with you and your loved ones' health goals. There is an online program that's available. It's being developed by the New South Wales government. It is called the Get Healthy program, and you can see a lot more information about it on the website. And basically you can receive a free consultation. You can have a discussion with someone about your specific needs. I would definitely encourage you to check out that website if you are interested in changing up your diet. Okay, so assistive aids, as a carer, you can actually support your loved one in selecting and using assistive aids that help in managing their symptoms. There are a number of different aids available which could be beneficial for them long term, and it does depend again on how severe the arthritis has gotten, which joints have been affected. But by speaking with an occupational therapist or one of the organisations that can help with providing these assistive aids, they can help in organising these and these tools for a better daily functioning. So there are special tools that are available for gripping, joint braces, or mobility aids. Often to acquire assistive aids, you do need to do a little bit of research. You do need to look at the tools that are going to best fit the person's specific needs and the budget. Some tools are available for buying, some are even available for hiring. And so with some of the organisations, they will help you with a thorough assessment if it's required. And even depending if your loved one is eligible, there are some schemes under the NDIS or My Aged Care who can help with funding for these assistive aids. You might be heavily involved in this process, then you might be required to help them select the tools. You might have a role in learning how to use the tools, adjust them. You might have a role in maintaining the assistive aids, like keeping them clean, making necessary adjustments. And so as a carer, you might want to learn a little bit more about what tools are available, how to go about using them in the household, so you can work closely with the healthcare provider to make sure that these aids are going to be set up and used correctly. So your encouragement here and your patience is incredibly valuable, and I would encourage you to have a look at some of these websites like the Nth Care, ADA, the Australian Pain Management Association, Assistive Technology Australia, and Home Modifications Australia. So there's a lot of different, there's a large inventory that on these websites that you can look at, and you might think some of them could be useful in your household. So medications commonly used in pain management. This can be really challenging to navigate as a carer because there are so many widely available. What's important to know is that some of these medications can help alleviate mild to moderate pain temporarily, such as the analgesics. The most common ones are going to be paracetamol and osteopanadol, which is a slightly higher dose of paracetamol and released a little bit slower, but is used to last a little bit longer and provide that relief from pain over a slightly longer period of time. Some of the other classes of medications work a little bit differently in that they act on suppressing the inflammation in the affected joints. So NSAIDs, which are your non-steroidal anti-inflammatory drugs, these are often used in arthritis because they're effective in reducing inflammation. So this can be like your ibuprofen, your Nurofen. They're over-the-counter medications which can be taken based on the severity of pain in a given moment. So they work a little bit more effectively in that they can help suppress that inflammation causing the pain. The other more stronger types of drugs that are available for managing arthritis are going to be things like DMARDs, which are your disease-modifying anti-rheumatic drugs, which not only work to reduce inflammation, but they do aim to target the underlying causes of the inflammation. So if there is inflammation coming from a very specific joint, they do they work to suppress this by suppressing the overall immune system. Your corticosteroids, on the other hand, they can be taken as tablets or they can be given by injection. And these would work to suppress the immune system in order to reduce the inflammation. So these ones can be used to treat rheumatoid arthritis or a single inflamed joint. In order to receive this type of treatment, it does need to go through a doctor, and a healthcare provider needs to prescribe this and administer it. So these type of medications are used for more moderate to severe pain when inflammation is present. Opioids are an even stronger class of drug. None of these which actually fix the problem, which is why they need to be used with a lot of caution, and we emphasize on that a lot. As a carer, you can help encourage the person with arthritis to understand why their medicine is being taken, find out what the possible side effects are. You can read all the medication labels, take them as directed. You might want to keep a personal record of all the medications being taken, just to make sure that we're managing any kind of risk that comes with taking a lot of medications at once. You as a carer can talk to the doctor or pharmacist just to understand what they're all about, even if there is some consideration in taking complementary medicines or alternative treatments like vitamin, mineral supplements, herbs. Definitely talk to your healthcare provider or a pharmacist just to make sure that they're going to be safe for you taking. They're not going to be contraindicated with any of these pain management treatments. So you're definitely asked to, it's definitely best to speak with the doctor and be aware of what to watch out for. And, you know, going to the pain medication for relief can be an immediate response to really help your person out when they're having a bad day. They aren't always going to be the best solutions, and so we do really encourage you to explore these other type of pain management strategies like pacing, meditation, mindfulness, distraction, and there are a lot more other strategies available and evidence-based as well. We have some more information about this on our website, but pacing is becoming a more popular technique that it does involve breaking up activities into management portions. This involves taking regular breaks to rest, recharge, and the idea is that it prevents overexertion to reduce the risk of a flare-up. So it's more of a preventative technique, which can be really effective in conjunction with some other different strategies. Meditation and mindfulness are more techniques that can be beneficial in the case of a flare-up and can be beneficial for the management of inflammatory conditions. Given there is a role in stress and the hormones released from the stress and inflammation, incorporating meditation and mindfulness can be effective in a way to actually control that. It does take a lot of practice, but it can be built into you and your loved one's daily routine. And we're starting to learn more about the efficacy of it. It's still quite a new area in terms of using these techniques for pain management, but the more we learn about it, the more promising it's becoming for pain management. Distraction is another helpful technique that really involves focusing the mind on an activity or task to take away the attention from the pain. I can appreciate that it's a lot easier said than done. And as a carer, I can imagine you thinking, well, how can I encourage distraction? But things like engaging in hobbies, listening to music, participating in social activities, watching a movie, these are all very simple activities that can help with distraction and help in reducing that perception of pain. So in terms of improving overall well-being, looking at these mind-body techniques and looking at integrating them into a treatment plan can have a really effective role in improving overall well-being, reducing stress, reducing those negative emotions that could help with that perception of pain and the symptoms. Often it's a maladaptive stress response that can be seen in more severe cases of arthritis. And so this is why we try to encourage and we try to speak to trialing these other techniques to see if they work for you. So caring can be challenging in a lot of different ways. It can be physically strenuous, and this will depend a lot on which load-bearing joint is affected, how much movement and stability is reduced. There might be times caring can be really physically strenuous. If you're helping them find their balance, climbing the stairs, helping them with exercises and mobility stretches. You might also need to carry things from time to time. With these tasks, often the risk of injury increases quite a lot. And so this is why we try to look at the tasks that are being carried out, and we try to look at ways to make them easier. Caring can also be financially challenging with costs for medication, appointments, treatments, transport, assistive devices. All of these costs add up. You also have this paired with the costs of loss in income, productivity. And so it can be really financially challenging and stressful. Not only that, it can be emotionally challenging, isolating, and stressful. The journey can be really lonely, and it can require you at times to put your plans on hold. It can also result in reduced leisure time, less time to enjoy the activities you like. It can lead to social isolation. And so these supportive social relationships, at times they can be challenging to maintain when priorities and schedules are continually in flux. And so there's a lot of different responsibilities and demands that are taken on by a caregiver, and they do require a lot of cognitive input and emotional support. So this is where we start to talk about pouring for an empty cup and how can we prevent carer burnout. So you might have realized that there is a lot to actually know about caring for someone with arthritis, and carers can put so much energy into caring for others that caring for themselves becomes neglected. It can be really hard to fit in the time for yourself and look after yourselves, and this isn't really effective when you need to be caring for others. Like we said before, you can experience feelings of fulfillment, companionship, satisfaction, but it can be really challenging at times. And so sometimes it's not uncommon where you could feel a partial loss of your identity. And so what we want to do is make sure that you're also looking after yourself. We've got some tips and solutions here to help you maintain your physical, emotional, and mental health to prevent caregiver burnout. So building injury resilience, like we said before, the risk of injury is quite high when, some of your jobs are physically strenuous. But the key to building this injury resilience is exercise. If you're providing physical support, make sure you know how to provide it safely, and speak with a certified health professional who's involved in the primary care to show you techniques for preventing injury. You also want to make sure that you're finding ways to stay active and you're working on building your strength so you can overall boost your health. You can also boost your mood. In terms of financial planning, this is important because some of the costs that come with caregiving can be quite stressful. And so in the next slide, I've got some schemes to make you aware of that you could consider looking further into. Financial planning is really important for financial well-being. And, you know, if you find yourself unable to work at the same capacity you once had, these schemes might be able to help you just alleviate some of that financial pressure you're feeling and reduce that stress specifically attributed to that. You might be the one who is continuously providing the emotional support for your loved ones. So make sure you don't forget to seek emotional support for yourself. If you reach out to family, friends, or even a support group who can help you manage the physical, emotional, and practical challenges of caregiving, it can make that journey a little bit easier. For some jobs, workplace flexibility isn't really possible, but if you're in a position where you might be able to work from home, you might find benefits from making flexible workplace arrangements. If this is something you have been considering, don't hesitate to have this conversation with your boss. Also, taking regular breaks from caregiving is really important for preventing burnout. And it's really important that you get the rest that is well and truly needed. There are a lot of respite care options available that you could consider looking into. The Commonwealth Respite and CareLink services provide free and confidential information on local carer support. They could be useful for discussing potential respite care services. My Aged Care website as well has some more information on support services that are available for a short-term or long-term respite care. So when you are providing care for, say, your spouse, it might result in reduced income, maybe more expenses. Here are some of the schemes we have in Australia, which you or your person living with arthritis might be eligible for. If you're an Australian citizen or a permanent resident, you should all have access to Medicare. And so this is where the following schemes might be of interest to you. The short-term restorative care package, which is the first scheme that you're seeing here, is designed to provide flexible care for older people who really want to preserve their independence and autonomy with the help of a multidisciplinary team. So this could involve the treating GP or the geriatrician, can involve nurses, occupational therapists, physios, podiatrists, dietitians. Depending on what the needs are, it's a really good package for future planning. It does sit outside of the My Aged Care home care package scheme, and so it wouldn't be available to those who are already receiving this package. But if you're not, this program includes a 63-day intensive ongoing care in the home to learn self-management strategies for achieving an optimal level of independence based on goals and needs to minimize that need of care over a longer period of time. The next one you might be aware of, but it's the Chronic Diseases Management Plan. This is more of a structured approach to care, which is prepared by the GP. So there are two types of plans that sit under this scheme, including the GP management plans and the team care arrangements. The GP management plans usually cover the full costs of 5 individual allied health services over a 12-month period. And so if a select provider accepts this plan, you'll be eligible to receive 5 treatments under this care plan. The team care arrangements might be prepared in the case there are multiple conditions existing at the same time. So if there's any other kind of chronic diseases that have been diagnosed, like cardiovascular disease or type 2 diabetes, and the needs are a little bit more complex. This is where the TCAs come into it. They do require collaboration between the GP and the other healthcare providers, but they will fully cover the cost of those allied health services. The last one is the pharmaceutical benefit scheme, which is available to reduce the cost of medication. So under the PBS, the government will subsidise the cost of certain medications. Most analgesics, anti-inflammatory, anti-rheumatic drugs are usually covered, but if you have a concession or a pension card, this will further reduce the costs of certain medications. And so it's definitely worth asking the GP or the pharmacist about this scheme and regularly reviewing that medications that are used in the ongoing pain management. This can help with just alleviating some of that financial pressure that is felt when continually needing to kind of pick up prescriptions. With My Aged Care, it does sit a little bit outside of Medicare, but it's still a government initiative. So there are different levels of support which could be available to either you or your spouse and the person you care for, and more specifically through the home care package if the person you care about is of an older age, past 65 years. In terms of general support around the house, like cleaning, personal care, meal preparation, there is assistance that is available from 1 or 2 allied health services. And even if the person is planning to go through with an elective joint surgery, there is short-term respite care that is also available. And so the cost of these services are partially funded by the government. They do incur some fees, which you would be required to cover, but there is a lot more information available on the My Aged Care website and fact sheets. And what I do want to kind of make note of is that a face-to-face assessment is usually required for this particular scheme. It's often completed in the home, but time to complete this assessment is variable, but it's worth looking into if you are eligible or not. The last scheme I want to bring to your attention is NDIS. So this is more applicable to those who have received a diagnosis of juvenile arthritis or rheumatoid arthritis. They're more likely to meet the eligibility requirements. If they have a substantially reduced functional capacity or reduced psychosocial functioning, if their capacity for social or economic participation is affected, and are very likely to require support under the NDIS for the duration of a lifetime, there are different funding packages available which are tailored to give the person choice and control over the services. So this scheme, you do need to see if you are eligible for. If you have very specific questions regarding eligibility criteria, definitely jump onto the website. I've also linked the hotline at the very end of the presentation. And again, it would be worth seeing if you are eligible, if it means it's going to take some of those financial pressures off. So adapting to adversity. So the physical impacts, the emotional, the psychological impacts, there's a lot to navigate as a carer, but practicing reflections can really help you build your self-awareness, practice acceptance, and teach you how to listen to yourself. So what I've listed here are some prompts to help you reflect on your output as a carer. It's definitely worth thinking about what is currently working for you and the person you care for, what isn't. What are you happy about and not so happy about? What is causing you stress? What can you do and what should you not do? Can you take some time every day for yourself, even if it's 5 minutes? Are you prioritizing the most important daily tasks? Is what you are thinking about helping you or harming you? It's also not, don't be afraid to seek out more formal support if it's required. So this is where you want to think about if it's okay to keep providing the informal support. There are some circumstances where you might be required to look at more formal support. Have you also reached out and accessed the carer support services that are available? We've got some additional tips for the carer, which include understanding the condition. So understand that you can grieve, be emotionally affected. It's good to be really open and honest about feelings, coping mechanisms. And so you do want to acknowledge your feelings and grief. Learn to listen, because sometimes just listening to your loved one is all they need. You might not always need to be actively trying to fix them, reduce the pain, or help them. Sometimes listening just goes a long way. If you acknowledge your feelings and grief, this is one step closer to gaining that acceptance. It's good to be really transparent about how you're feeling in this caregiver journey. Accept that you won't be able to make the pain go away. This is a really big one. So sometimes all you can do is really just be there to support them through their pain and provide that emotional support. Making plans flexible. So it can be really frustrating sometimes to have a planned day out, or sometimes your loved one didn't sleep, or maybe they're having a flare up and in too much pain and they can't participate in the activities you had planned. Sometimes having a backup plan really helps. Instead of, opting for plan A, which might involve a bushwalk being planned, maybe you could do something else like driving to a lookout or going to the cinema. You can ask how you can help best. Sometimes you want to know what a good day and a bad day looks like, but you can just ask what support or help they might need. It's best to ask them what they want and how to help them. And this way you still get to help them, but it's also going to be more specific to what they need. It's also about celebrating the small wins. I think sometimes, just appreciating the small things that have made your loved one's day a little bit easier or a little bit better really goes a long way. Can be challenging to look for the silver lining, but with acceptance and understanding, hopefully you'll be able to appreciate that, this doesn't mean that your quality of life is destroyed or it's going to be poor. There are things that you can still do to maintain a really good quality of life. And so embracing the caring role as well. This comes with practicing acceptance again. So it can be really difficult in terms of, that's not what we wanted. It can be really difficult to embrace a caring role at times. It's very challenging, but how it makes you stronger and the more adaptive you become, the more you're able to kind of find the benefits in being a carer. But you do want to make sure that you're focusing on things that you can control. And it goes back again to differentiating what is within your control and what's out of your control. So I want you to think about what does self-care mean to you? So taking some time out for yourself to do the things that you enjoy, even just for a couple of minutes a day, can really help reduce stress and boost your mood. So I want you to think about what's important to you, what do you value, and what do you enjoy? If you want to share some of those things in the chat box, I'd love to see what are the most important things to you if you're reflecting on, self-care? We have some support groups here. Sometimes it really goes a long way to connect with other people who really understand what you're feeling and they have felt what you feel. So I guess we've got listed here some support groups that you can join to as a carer. And these can be online or in-person peer support groups. The Carer Gateway is an excellent site that looks at support specifically for carers. If you're a carer of someone living with juvenile arthritis, there is a parent support group and it's available through Arthritis New South Wales. I would encourage you to jump on and check it out. And those organisations that I referenced a little bit earlier on, the NDIS, the Medicare, My Aged Care, Beyond Blue, Lifeline, Kids Helpline. These are hotlines that can really help you understand what you need, what the person you care for needs, and help you put together a bit of a plan to make their journey a little bit easier. So I've just got some takeaway points here. As a carer, it's important to help the person you care about, but make sure you're not forgetting to help yourself too. So don't be afraid to ask for help and access support services. At Arthritis New South Wales, we have an info line that you can call up anytime if you need some further support around any of our services, our programs, which might be able to make your lives a little bit easier. So that brings us to the end of the presentation now. Does anyone have any questions for me? I'm also happy to pause the recording. If you wish to contact me, this is my email. I hope you all have that now. I'm just going to everyone in the meeting. So my email is mzagotsis@arthritisnewsouthwales.org.au. If you wish to contact me directly, definitely send me through an email. And I'd also love to hear your feedback. So tomorrow or the day after, I always forget that tomorrow is public holiday, you will receive a link to provide some feedback, and I'd love to get your thoughts around what topics you'd like to hear more about, what information would you like to receive more detail on, and definitely open to hearing your thoughts. So thank you, everyone. Have a great week.
Thank you, Mary.
Thanks, guys.